Hello, good morning, everybody. Happy Monday. My name is Dr. Lindsay Ogle, and I am a board certified family medicine and obesity medicine physician. Thank you so much for joining me. And if you haven't already, please check out my Instagram. It's at Dr. Lindsay Ogle, and I post several times per week, and I include some educational information there, some of my philosophies about treatment, and I would love to have you follow me, and I will have the link below. And also, if you like the information that you're getting from this YouTube channel, please like and subscribe as well. Today, we are talking about a very important topic, and that is heart disease. Heart disease is the number one cause of death in the United States for both men and women. Today, I want to give an overview and really focus on gathering information about your specific risk for heart disease and what you should do about the information that you get along with your wellness visit. And so, first, I'm going to touch base on the lipid panel that I talked about in a previous video about baseline labs. And if you remember from that video, there is the LDL cholesterol, which is known as the bad cholesterol, which you want lower numbers of. And then there's the HDL cholesterol, which is the healthy cholesterol, which you want higher numbers of. And it's important to know that if you see an LDL cholesterol of 190 or greater, it is very likely that you have a genetic reason that your LDL cholesterol is that high. And of course, diet and exercise is going to be beneficial to you, but it is unlikely that lifestyle modification alone is going to be enough to get that LDL cholesterol at a goal number. And so for those patients, we often recommend starting on a medication right away. I also want to note that this is really a focus on prevention and preventative medicine. So if you, or if you're thinking about somebody that you love and how this applies to them, if there has been a history of a heart attack or stroke or peripheral arterial disease, or if they've had a stent, this does not apply to them, and they should already be on a cholesterol lowering medication. Most commonly, those medications are statins, but there are other ones. Typically, the second line is a medication called Zetia, but there are several others available. So if you've already had a heart-related condition, a diagnosis, then that changes things, and they will probably already be on a medication for their cholesterol. So what do I do when I get these cholesterol labs back? First of all, I look at that LDL number, and if it's 190 or greater, I make sure, were they fasting? If they weren't fasting, we'll repeat it fasting. But if they were, then I do go ahead and recommend starting a statin. Typically, I prescribe rosuvastatin, but there are several others available. And then we get started on that medicine, and after taking it for about 2 months, then I often repeat the cholesterol lab and make sure that it has gone down. And we expect the lab actually to go down by 50%, and we often do see an improvement that quickly. If not, then maybe we need to go up on the dose of the medicine. But if the LDL cholesterol is high, but maybe not above 190, then I use this calculator called the ASCVD risk score, or risk calculator. And what this calculator is it's actually taken thousands of patient data and created this calculator based off of their data and their outcomes. So it's able to estimate based on cholesterol levels and blood sugar and age and sex and race and lots of other patient factors, how likely it is for a person to develop heart disease or have a stroke or a heart attack in the next 10 years. So it gives us a estimated risk. And any calculation that provides an estimated risk of less than 5, then we consider that low risk and we can kind of monitor things at this time. We can tweak certain risk factors and continue to lower that risk, but we do not need to start a medication. If the estimated risk of a heart attack or stroke over the next 10 years is between 5 and 7.5%, then that is considered moderate risk. And in that category, I like to have a risk benefit conversation with the patient. And maybe if they have a significant family history of heart disease or stroke, I would lean towards starting a medication at that time. If they don't and they're really motivated to make some lifestyle modifications, then I would focus on that and then repeat the lipid panel in a year and then reevaluate at that time. That's where the individualized decision with your doctor comes in handy. There's also another type of test I'm going to talk about after this that can give us more information to make that decision for that individual patient. And then anyone who has an estimated risk of 7.5 or greater, we consider that high risk, and I do recommend starting a cholesterol lowering medication at that time. I will include a link for you to be able to calculate your own risk of heart attack or stroke within the next 10 years based off of the data that you have about your health. And then the final thing I wanted to talk about today is another preventative test that we can utilize to determine your risk of heart disease now or in the future is something called a coronary artery calcium score. Now, this is a test that has been around for decades, but has only recently been more commonly used. There is still not clear guidelines on how it is best implemented, and the way that I really use it is for those borderline cases where somebody has an elevated cholesterol, but they have a normal blood pressure, they don't smoke, they don't have diabetes, they don't have other risk factors for heart disease. So I'm not starting a cholesterol lowering medication at this time. Maybe we want to have more information so we can feel better or more confident about that decision. Another time it's used is if I do recommend a cholesterol lowering medication, but a patient does not really want to take a medicine or they particularly don't want to take a statin, then we can do this test, and if we have a reassuring coronary artery calcium score, then we can feel good about the decision to not take a medication. And again, it just gives us a different angle to determine the risk of heart disease. And so what is this test? It is a CT scan of the chest, and the CT scan, the goal is to look at the arteries that supply blood to the heart, the coronary arteries. If you've heard of a heart cath, the procedure where someone's getting a cardiac stent, this is a way to non-invasively look at those arteries. And what the CT is looking for is calcium or plaque buildup in the arteries that supply blood to the heart, the coronary arteries. And if the radiologist does not see any, that's great, and the score is 0, and that's really reassuring. And I typically say we can repeat the scan in about 5 years. And then if there is some plaque buildup or calcium deposits, then it's a graded response after that based on how much is present. And it can actually tell us which blood vessel that the plaque is on. It gives us some really good information. So the lower the number, the less risk. The higher the number, the higher risk. And what I typically say is any number less than 100 is a fairly low risk, and then it's really a graded response after that. Numbers greater than 300 are higher risk, and I typically refer to cardiology at that time. Numbers with between 100 and the 300, then I definitely recommend a cholesterol lowering medication. And even numbers less than 100, I often recommend a cholesterol lowering medication, in addition to managing the other risk factors such as quitting smoking, managing diabetes and blood pressure, increasing physical activity, cutting back on processed foods, cutting back on alcohol, cutting back on stress and increasing sleep, all the things that help us be well overall. It's important to know if you're getting the coronary artery calcium scan that even though the goal is to look at the heart, the scan will also look at the lungs. And this can be a benefit, especially if somebody is at higher risk for lung cancer. It's effectively a lung cancer screening test, which is pretty nice. But for somebody who is at low risk of lung cancer, occasionally we pick up what we call an incidental lung nodule. And depending on the size, there may be a recommendation to repeat the CT scan in a year just to monitor that lung nodule and make sure there's no changes to it. So I see that occasionally. It's not anything to really worry about, but it may trigger additional testing for the person who got the test done. This talk was really more focused on heart disease prevention. There's so much more I would like to talk about, and I look forward to talking about in future videos. So as always, if you have any questions, comments, concerns, please comment below. Also, feel free, like I said in the beginning, to follow me on Instagram. You can message me there if you would like a little bit more of a private feedback or question. I'm happy to provide as much education as possible. Again, I am not your primary care doctor. I can't give individualized advice, but I can give general medical knowledge. I am so excited to have you here. Thank you so much. I will see you all again next Monday. Take care.